and I would like to thank everyone for joining us today. And my name is Vito Gearity. I'm the Senior Programs Manager here at NHMA. And thank you for joining the Managing the Risks of Heart Disease and Flu Among Latinos. This is the second session of our Instagram Live series. I do also want to take the time to thank Sanofi, the National Forum, Families Fighting Flu, the American Heart Association, the American Osteopathic Association, and the American Black Cardiologists. So we can get started. I do want to have our speakers introduce themselves.
Eduardo Sanchez. I serve as the Chief Medical Officer for Prevention at the American Heart Association. I also am the Principal Investigator for something called the National Hypertension Control Initiative. And at the American Heart Association, I serve as the executive, or I am a co-executive sponsor of our Latinx Employee Resource Group. And I'm very pleased to be a part of this discussion today. Flu, heart disease, February being Heart Month, a convergence of important issues. One, it is Heart Month. Heart disease and stroke are the number 1, number 5 killers of all Americans. They're also the number 1 and number 5 killers of Latinos. But the thing that we know is that it's still not too late to get vaccinated for flu because flu is a bad thing in and of itself. It does kill people. Maybe not the way COVID-19 has killed people, but it does kill people, particularly seniors and people with underlying medical conditions. And that includes individuals who have cardiovascular disease, have high blood pressure, have high cholesterol, have diabetes. And so anyone over 6 months of age should be getting vaccinated for flu. But in particular, elderly folks and folks with underlying medical conditions and folks with both even more so. Get in line, get vaccinated. It's not too late to get protected.
Let's talk about some of the risk of flu complications compounded by pre-existing conditions like heart disease.
Well, so we know that, of course, influenza by itself can cause pneumonia. And while that's not a cardiovascular disease, that's a pretty bad thing to get. But the other thing we know is that getting the flu increases the likelihood of what are called major adverse cardiac events. And that includes heart attacks and stroke. So it's really, really important to get a flu vaccine because it's going to keep you from getting the flu and keep you from getting those bad things that can happen, particularly if you have a predisposition, if you get influenza.
Some of the co-administration that is available for the flu vaccine and other treatments.
So I'm not exactly sure what you're asking me there, but let me just say, I would be remiss if I didn't say that, particularly in this time, as we are in a new phase of COVID-19, that individuals who perhaps had delayed care, deferred care, for any other reason, stopped getting care for any medical condition, but let's focus on heart disease and the cardiovascular disease risk factors like hypertension, hypercholesterolemia, diabetes. Get connected back with your doctor and get back with whatever plan was in place. There might need to be some updating, but get on your medications. One thing we've learned from COVID, and we don't have quite the robust kind of research where these associations are available with regards to influenza that I'm aware of, is that it appears that people who have heart disease and are on their medications for high blood pressure or cholesterol seem to have a lower risk of having complicated COVID. I can't help but think, because the biology makes sense to me, that that same degree of risk reduction could apply to influenza. So get on your meds, get vaccinated. And oh, by the way, if you haven't gotten vaccinated or you still have some COVID vaccine to catch up on, either the second vaccine or the booster, you can get the flu and COVID vaccine at the same time. They can be given at the same time. It's perfectly safe.
Yeah, absolutely. I actually just got mine done. at the same time, a few weeks ago, I tried to get one in each arm, but the doctor told me that having one sore arm was better than two. So they went both in the same arm. Moving on in general, when we say, everyone should get vaccinated, who exactly are we talking about when we say that? Dr. Velarde, I think we can hear you now.
Yes.
There we go. And that question is for you. Well, yeah, so I just wanted to touch on the importance of flu vaccination in general and who exactly should get vaccinated.
It is not, first I should say that the audience, no, thank you, madam. The audience should know that it's not a benign condition. Can you hear me okay?
Yep, you're good.
Yeah, it's not a benign condition. It can kill you. But on the other side, it can be prevented. So those are key messages. It's not benign, it can kill you, and it can be prevented. And that's why it's so important that this gets addressed. The other thing is that by not being benign, it's top 10 reason of death in Hispanics. It's number 9, I think, when you have the flu and pneumonia. So, it's a 9th leading cause of death in Hispanic Latino community. So it's really important.
I say one thing, Doctora Velarde, introduce yourself. I got a chance to tell people who I was.
Yes, my name is Gladys Velarde. I am the director of the Cardiovascular Fellowship Training at the University of Florida in Jacksonville. And I am a preventive cardiologist and echographer by training. And I love my community. I'm doing this for 2 decades. And I'm here because, as representative of the Association of Black Cardiologists, as a woman of color, brown Latina, that is very engaged with my community. And I think this is a tremendously important issue that we have to address.
Excellent. Thank you, Dr. Velarde. And thank you, Dr. Sanchez. Moving on, Dr. Velarde, another question for you. I know there's been a lot of talk between, the current state of the flu with COVID and everything. And I wanted to know about how, what the current state of the flu is over the past few years.
Well, what I can tell you is that, at least from what I have read initially, is that what we have experienced as clinicians is that we were bombarded with all these waves. I don't know how many had already COVID, and that dominated the clinical profile, is respiratory illness, and so the appearance of the seasonal representation of the flu seemed to be muted by the COVID infection. However, what I know is that the current state, the CDC estimates that so far more than almost 2.5 million flu illnesses, with more than 22,000 hospitalizations, and more than 1,000, almost 1,500 deaths from this season alone. And Dr. Sanchez may correct me with more accurate statistics, but that's just this season. And you can imagine how challenging diagnostically can be when you have co-presentation, because they do but the flu season starts usually in October and then runs its course through the winter. So yes, the coexistence can happen, but severe disease can happen. If we've had 1,300 deaths already in the season, then that's significant. And the vulnerable groups, which happen to be the same vulnerable groups that are for COVID, are the ones that we really need to pay attention to. And I don't know if that was addressed already with the vulnerable groups.
I talked about it a little bit, but you know what? I'm a believer that we need to repeat things that need to be repeated, which is, you asked the question earlier. I just jump on and say, anyone over age 6 months, unless there's a contraindication, and that is determined by talking with your doctor, Dr. Velarde and I would say, go get a flu vaccine. It's still not too late. The flu vaccine is slightly differently formulated depending on age. The really young pediatric, the adult, and then the senior. But they provide protection, not only from flu, as was mentioned, not a benign disease. It can kill you. And who wouldn't want to have a higher likelihood of not dying? I do. And then the other part of it is that if you are elderly or if you have an underlying medical condition, particularly cardiovascular disease and stroke history with regard to this conversation, and the risk factors like high blood pressure, high cholesterol, diabetes, run to get your vaccine instead of just walking to get your vaccine, and it's still not too late. The other thing we talked about is you can get both vaccines, COVID and flu at the same time, no matter what stage of the COVID vaccine series you're at. Number 1, number 2, or the booster.
Right. And I don't know if you're asking about some of the current state of affairs. You look at those vulnerable groups, and we as myself as a cardiologist, look very much at the data that is pertinent for my patients, right? Out of the many millions that have coronary cardiovascular disease already, and we're talking about more than 30 million adults, those are at a particularly increased risk. I know for studies that within the first week of the acute infection, within a week, there is a significant risk, and to the tune of 6 times the risk of having a bad cardiovascular event if they are not vaccinated and they have the flu within that first week of being infected. So that's significant. And we also know that from those patients that have been hospitalized with the flu, there 1 out of 8 of those patients will have a cardiovascular event. So or will have a serious complication from the flu. So it's not benign, and it is upon us, not just cardiologists and pulmonologists or primary care providers, it's for all of us to address it. I don't know, Eduardo, I was reading yesterday because I was kind of a little bit of preparation for this talk, and I was interested to see that the number, there was a study, don't quote me where the study was because I can't remember, but the study looked at how many subspecialty physicians, cardiologists, had and were prepared to administer the flu vaccine in their offices. And the number is dismal. It's like in the 20%.
Yeah.
So I'm not necessarily making a position that we should all have the it depends on, it's a systems issue, but it may not be a bad idea. And
That's right.
It's not a bad idea, and it should be a standard of care that we say, hey, we know, the cardiologist knows where they're distributing and administering the flu vaccine when you see your patient. I have done that with the COVID vaccine. I see my patients and I tell them this is where it's being given, go, and it's usually within the confines of where you practice. So
yeah, I couldn't agree with you more. There's a couple of things that I think are important for us to remind all of us. One is that you and I are doing this because the rate of vaccination among Latino Hispanics is lower than it should be. It should be 99%, but it's lower than that of the general population. We got some work to do. And even the general population is running at best on a good year at about 50%. It's a little bit higher among seniors, and even among seniors, it's not where it should be. So we have work to do. But I couldn't agree with you more that we need to figure out how to make sure that we find more opportunity to connect vaccine with people. So community pharmacies, really important, and some of that exists. Physicians' offices, more of them, couldn't agree with you more. Hospitals, if someone's getting discharged period, because we just said everyone over 3 months of age should be getting vaccinated. And then anywhere else that works for populations, whether that's a rec center or a fitness center or a senior center, whatever it may be, some ways to facilitate getting those vaccines. I think one other thing to mention, Dr. Velarde, Gladys, is that you were talking about the challenge you had just getting onto this. There are too many of our patients where a technology solution has to be supported by some high touch. And we need to be really, really careful not to assume that just because we've set up an online opportunity that it's going to work for all of our people. So we need to be mindful of that, and we need to take the vaccine to where it needs to be and make it as easy as possible to get. I love technology, don't get me wrong, but sometimes we have to acknowledge that sometimes technology doesn't love some of the users, and we got to help them get over whatever that technology was supposed to help them achieve, a vaccine in this case.
Yes, that, we talk about this social determinants of health and how poverty and where you live and where the food that you eat and your access to care affects things. Well, now we are, in this time, in present times with such technology, there is a disparity there, and you just alluded to that the connectivity issue is just as bad as living in a bad neighborhood without any resources to centers that can allow you the luxury, which should not be, of having the care that you need. So connectivity is something, and I couldn't agree with you more, Dr. Sanchez, Eduardo, that that we need those to partner with those agencies and those private sector, public sector, and making sure that connectivity issue does not become the disparity of the future.
That's right. No, well, and it is a disparity already. I think I'll. Oh my gosh, we have someone else, hot dog. So
there we go.
Let me just say that when it comes to this issue of the digital the health technology, I like to think of three things that we have to try to help overcome. One is access to the access. Is it available and accessible? Is it affordable? And then what's the digital literacy level to be able to use it? And
right.
We've got to work with our communities, whether it's about flu vaccine, cardiovascular disease, or whatever it may be. If it's going to be something that we believe can help, we have to make sure that it is helpful to those for whom we're trying to provide that help and provide that guidance.
Thank you, Dr. Sanchez. I did want to take the time now to introduce our final panelist, Dr. David Garza. Dr. Garza, you could introduce yourself.
While I think it bears repeating, while we're probably towards the end of this seasonal flu season, it is still not too late to get vaccinated. And we all should do what we can to mobilize information and then mobilize distribution for next year, starting in September, definitely with information, possibly begin vaccinating people. It's not too early in September, but really kind of ramp up in October as flu season gets started. It bears repeating. It's not a benign disease. Even when you get it and it's not too bad, it's bad. I can remember, Gladys, I got it when I was in residency, and it knocked me down. It took me down for several days. But if you've got an underlying medical condition or you're elderly, it can kill. And I think our message is the vaccine will keep your loved one from dying from a vaccine preventable disease.
Right, right. I do. You're remembering things. I've gotten the flu. It was bad, but I remember how it affected some of my heart failure patients. Patients with underlying cardiac disease, they can get deadly ill. Even vaccinated, they can get sick. However, they don't. The axiom is that it's like COVID. It prevents you from getting severely ill and dying. So in many ways, the COVID situation has allowed the infrastructure to be a little bit more conducive. And so now we need to use it and we need to expand it, like Dr. Sanchez said, so we can buy the vaccination.
There was a question in there about somebody who had severe cardiovascular disease and emphysema. Is there any risk to COVID-19 vaccine was the question. And I think, you tell me if I'm wrong, Dr. Velarde, but there is no downside. That is the exact person that ought to be getting a flu vaccine today if they didn't get it yesterday or this season, and they should be getting their COVID vaccine. No downside. Even the side effects of either of those vaccines in general. We heard earlier, it might give you a sore arm. In my case, the COVID vaccine did not make me have I had no symptoms, but more importantly, because I'm a young 62-year-old, my 87-year-old mother, my 84-year-old mother-in-law, they got COVID-19 vaccine, they've gotten flu vaccine, and they had no symptoms at all with them. I'm not telling you you won't. I'm just telling you that you may not, and even those side effects or soreness, you might feel a little run down for a day or two, but if you are somebody with cardiovascular disease and emphysema both, you do not want to get COVID or flu. You want to get the vaccine. Correct.
I couldn't be more emphatic about that. You are absolutely right. I actually got the booster my booster was at the same time I got my flu vaccine. So you can get both. It's okay. It's safe. It's okay. And if that's the opportunity that you have to get your flu when you're getting your booster, so be it. Get it. The alternative of no, I'm gonna wait. It's really, it doesn't have any scientific base to wait. So you can get it at the same time. Some people have local issues like on the arm. I had a headache. I had a bad headache with the first injection, and it happened, and as quickly as it came, and it within about 4 to 6 hours after I got the vaccine, as quickly as it came, it went away. So without warning, it wasn't like it came and it went. It lasted for a few hours and it left me. I did take Tylenol, and that might have improved it, but I didn't get any symptoms with the second one other than the arm. And I felt very strong when I got my booster, so I got my flu vaccine along with it.
Yeah, my name is David Eduardo Garza, and I'm an osteopathic family physician from Laredo, Texas. I was in private practice for 25 years before I started a family medicine residency there. And a couple of years ago, I joined the faculty at the University of Incarnate School of Osteopathic Medicine, where I'm serving as interim dean for clinical affairs. I know we're almost out of time, but I like when I would talk to my patients about motivational speaking and trying to get over their illnesses or prevent illnesses, I would use personal stories. So I'll start with a personal story. 27 years ago, I had a conversation with somebody who was 44 years old, who had hyperlipidemia, hypertension, and bad family genetics for coronary disease. And I spoke to him, and he told me he was feeling bad. He thought he had a cold, maybe a flu. And then shortly after that, the next call was that he was having a heart attack. And he was my brother, and he did not survive. He was only 44. And so that underscores the genetics and the critical overlap between flu disease and coronary disease. And so my message is, Hispanics are genetically predisposed to have not only hypertension, hyperlipidemia, but diabetes and all those other comorbidities. So when you throw the flu on top of that, it really, really lights a fire. And so, we could talk about, flu treatments and those kinds of things. But the main thing is, as Dr. Sanchez and Dr. Velarde very eloquently mentioned, prevention. And like Dr. Sanchez says, run and get your flu shot unless there's a contraindication, and most people are not. So it's a very personal story, which lasted for me forever. I always get my flu shot. And the other thing that we emphasize is everything that we've learned about preventing COVID overlaps with preventing flu, distancing, taking care, washing your hands, but really getting your flu shot. And also, if you are at risk, then you get your pneumovax as well, because pneumonia is one of the horrible complications of influenza.
Thank
My
you so much,
condolences, Dr. Garza. Even years afterwards, I couldn't imagine going through what you went through. Thank you for sharing.
Yes, thank you.
Yeah, we appreciate that. Thank you. I do want to address two quick questions that we have been receiving from our audience. I know we do have to go, but the first one is, and anyone can jump in, how long does it take for the flu vaccine to be fully effective?
2 to 4 weeks.
2 to 4. Wow, longer than I expected. Okay, great. Thank you.
You asked the question about fully effective. So it takes a little while, and you're going to get some protection maybe within days, but it's going to take a little while. But it's still not too late to go get a flu vaccine. I don't want to dissuade anybody by saying what I just said.
Absolutely. And then in terms of getting, say, your booster or the COVID vaccine at the same time as the flu, is that something that, anyone can just go ahead and do? Or is that something that should be consulted maybe like with their physician or someone beforehand? I'm sure that's probably situational.
So listen, I'll just jump in and say it's never a bad idea to reach out to talk to your doctor. But I think that all three of us would agree if it's going to be 3 days before you talk to your doctor and you generally are okay. I mean, if you have a number of really serious things, you might want to wait. Run and get that flu vaccine. In general, it's okay. There are no contraindications. Flu vaccine, it's allergy to eggs is the only contraindication. And with COVID, very few contraindications. There was a question about side effects and what's the statistics. Here's the most important statistic. If you're vaccinated against these diseases, both COVID and flu, you're much less likely to die as a result of getting infected or being exposed, period. So Drs. Garza and Velarde, please.
I would like to say that, we still have those questions about safety. There's no contraindication to get the two vaccines. Obviously, you can always speak with your provider, but if you are relatively healthy, you're not having, and by healthy, I mean, you're not having an active situation or active illness. Getting the two vaccines should be no problem. But with regards of safety too, people have to realize that almost 2/3 of humanity has been vaccinated. So these vaccines are safe. So, when you have humanity there vaccinated, that's what is going to get the public health protection that we need, and be prepared for whatever comes next. Crossing my fingers that doesn't happen. But
I got both of mine on the same day.
Yeah, and what you just said, Dr. Velarde, about what we know about COVID-19 vaccine. Think about flu vaccine, which we've been administering for a little longer than 2 years. Exactly. I'm exaggerating, of course. So we've got decades of history, knowing that this is both of these are relatively safe. Nothing is perfect. Relatively safe, and compared to the alternative, very, 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 very favorable to get vaccinated versus not.
Right.
Perfect. Thank you. I do have another quick question. It's too good to not ask. Real quick, how can we, this was from Sarah Hartswick. Sarah, thank you for your question. How can we specifically assist our Latinx patients in getting access to flu vaccines, and maybe where can they go?
I'm jumping in. One, go to the, first of all, if they have a doc, call the doctor's office. Many physicians do administer the influenza vaccine. And in your community, I think the other thing I would say is reach out to the local health department in your community. You can find that online or, however else you get information, and then make that call. Where is flu vaccine available? Third thing, we all have a pharmacy chain that's 2 blocks away from wherever we live, and might even be another one across the street. They administer flu vaccines, so do supermarkets. And what might be important is to be with that person who might just not want to stand in line and feel intimidated by the whole experience. That's the role that we can play. Hand-holding goes a long way.
I agree. Their accessibility should not be a problem. It's convincing people to get that vaccine.
Right.
Connecting them to that access.
That's correct. And that, I think I alluded to that in a prior answer, that when you see a provider, these clinics are oftentimes within the constraints of the practice, and we providers have to make that leap of connecting the patients to the resources. I make it a point that myself and my fellows who I train know where that clinic is when they see the patient. Oh, by the way, did you get vaccinated for the flu? And do you know that we're providing it on the second floor, on the pharmacy clinic, on the ambulatory center? So you just go. There's no, if you know the workings of your institution, and on top of that, you have the pharmacies that the Publix, the Walgreens, the CVS, they all provide this service, or should provide this service, or should know if you call your local pharmacist as well.
Excellent. Thank you all so much. Again, I do want to be respectful of everyone's time, so we will close on that. I saw some things in the chat about free resources. I do want to let everyone know that NHMA, we do have an entire hub of free resources. We do have flu on there. It's hispanichealth.info. I would encourage everyone to go check that out. There's a lot of information, and we take information from a bunch of different places. So it's all diverse, and it's free. So please go check that out. Thank you, Dr. Sanchez, AHA. Thank you, Dr. Velarde, ABC. And thank you, Dr. Garza with AOA. I really appreciate all of your time, your insights, and I can't wait to do another one in the future, and look forward to seeing all of you soon. So everyone, please stay healthy, get your flu shot, and we'll see you soon. Have a great weekend.
Bye-bye.
Thank you.
Bye. Thank